Ladies and gentlemen, welcome back to the channel. This is part 2 of the best pain medication for dogs. So the first one, we talked mostly about what the different non-steroidal anti-inflammatories are. And in this video, we're gonna talk about all of the drugs that don't fit into that NSAID category. If you haven't already, make sure you hit the like and subscribe button if you want more content like this and like my other video. And if you haven't already, go check out that video first because NSAIDs are going to be the pillar of most of our pain management techniques. Also, if you wouldn't mind, I do have a Patreon page where we are uploading these videos several days early, up to almost a week earlier on the Patreon page. And we also are going to be doing some live Q&As. I have a Guess That Species competition where we'll do some different x-rays and different pictures and things that you guys can guess the species or guess the procedure. And that is going to be Patreon only, so feel free to go check that out down in the description below. So like I already mentioned in the last video, we talked a lot about NSAIDs, and NSAIDs are going to be the pillar. They're going to be the main pharmaceutical drug of choice most of the time for pain management. And that's because they work so incredibly well for controlling pain, especially in dogs with osteoarthritis. But we also are going to talk about all these drugs that are not going to fit in that NSAID category, because a lot of times NSAIDs are fantastic and should be used, but they're not enough by themselves. And so in this video, that's what we're going to focus on, are the drugs that should be used probably alongside an NSAID in most cases. So this is kind of a list that I got from the Canine Arthritis website that I will link down in the description below. So I'm going to talk about a few drugs that I haven't heard about before, and I've never used some of these. And the first one is Amantadine, and I can't say I've actually ever used this medication. It's primarily an antiviral medication in human medicine, but it also acts on a similar receptor as an anesthetic called ketamine, and this is the NMDA receptor. Long story short, it works similar to ketamine, which is an anesthetic that we use when we're trying to put our patients under anesthesia. It doesn't really appear to be very useful by itself, but it can be very useful when used in combination with an opioid, an NSAID, or maybe another pain medication. So, never used it. If you ever have used this or your pet's ever been on Amantadine, let me know down in the comments below how it went and if it seemed to work for you guys. Maybe I'll try it on a couple of my patients in the future. Now the next drug, or drugs, because I'm going to combine two here, are Gabapentin and Pre-gabalin, or Lyrica. So you've probably heard of these two drugs as Neurotonin or Lyrica in humans, and they're both used for a variety of reasons and have been used to pretty irregularly as far as what they're used for. They're labeled for neuropathic pain in humans, and these drugs are still somewhat a mystery on exactly how they work. But in my experience in dog and cats, they're very, very good for chronic pain. And we mostly use gabapentin in our practice, mostly because of the cost differences. But the doses that are going to be necessary for good pain management in dogs are pretty reasonable. The side effects tend to be very minimal. Sometimes we'll see sedation, sometimes we won't. A lot of times we won't. The other side effect would be basically ataxia, or looking like they're drunk almost. But both of these are very uncommon. I've seen them a couple times in cats when we're in the really high end of the dosing range, or maybe even a little over the dosing range. But especially when it's used with an NSAID for chronic pain, you can get really good pain control with gabapentin. And so I do highly recommend this for a lot of my patients, especially because it's fairly inexpensive, low side effects, great drug. Now, the next drug is Tramadol, and this used to be one of the go-to medications for osteopain, so osteoarthritis, whether we're talking about post-op after an orthopedic surgery, or just surgeries in general, and it's still used in a lot of practices today. Although there are several very recent studies that have indicated that its pain management is minimal at best and pretty dismal at worst. And so my personal preference is not to use Tramadol at all. And I know there are actually some surgeons who would disagree with me, and there's some veterinarians that would disagree with me, and that's fine. That's just my preference based on the studies and the dogs that I have seen it used in. It really wasn't adequate for their pain. So take that for what you will. Some vets will still want to use it. Go for it. It's not going to hurt them. But I think that going with something like gabapentin and an NSAID are going to give you better results most of the time. Now, the next drug is methocarbamol. And this is actually a muscle relaxer that I've never used. It's typically used for trauma related to muscle tissue, and it's also been used in cases of intervertebral disc disease or like a slipped disc in dogs. I think there are very, very few cases where methocarbamol would be useful in our clinic, and so I've just never used it, and will substitute in another pain medication when necessary. One of the other ones is codeine. And so in humans, codeine is fairly useful for pain management, especially when combined with Tylenol or acetaminophen. But in our veterinary patients, it's very limited. In dogs, the bioavailability of codeine.
Hey guys, me from the future. I forgot that I did not say what bioavailability means, and it's a big word, so I figured I'd explain it really quick. So bioavailability is basically the amount of drug that the body has available to it once it's ingested. So basically, poor bioavailability means most of it just gets pooped out, and good bioavailability means that most of it is absorbed. So hopefully that helps. Moving on.
The bioavailability of codeine is extremely low, and so I don't recommend codeine to any of my clients. I would recommend hydrocodone for collapsing trachea in some dogs, but not for pain in almost any circumstances. There's just better options. And a lot better bioavailability and a lot less risk of clients going and maybe selling this drug to people when it's given out for their dog. So again, personal preference. Now another one is Amitriptyline, and this is an antidepressant that is occasionally used for pain relief. I really don't think I would reach for this one unless I was pretty desperate or if I was using it alongside for an antidepressant in dogs. I've seen it used in aggressive dogs with pretty good success. But if any veterinarians that are watching or looking at this, or pharmacologists, if you guys have used this drug in animals for pain relief, go ahead and let me know down in the comments, because I'm just interested in knowing, if it has been used, and if so, how successfully. So what about cannabis or CBD oil? I'm gonna make a full video on this subject at a later date, but I personally don't recommend using CBD oil at this time to my clients at all, and I'll outline those later in the video. I'm not saying that it couldn't have benefits or doesn't have benefits, but I just don't recommend it at this point for some reasons that I don't want to spoil for a future video. What is my favorite non-NSAID for dogs with osteoarthritis? Well, it's gabapentin. The biggest reason is just the fact that it has such low side effects compared to a lot of these other medications. It pairs extremely well with most of our NSAIDs, and it is super inexpensive. At this point, it is very inexpensive, and it's a very good drug, and I've seen it work in a lot of dogs. So it may not always be enough by itself, and I typically will recommend pairing it with Galliprant, or pairing it with Previcox, or pairing it with Carprofen, any one of those, pairing it with one of them, and the combination can be super, super helpful when they're both used together. Also, the other thing that I really wanted to mention in this video quickly is that don't go ahead and just take all of this as gospel. This is my opinion and my experience in clinical practice. Now, although somewhat limited because of just how long I've been out of school, I do think that I learned a lot, and that my professors and the surgeons that I had at Iowa State were fantastic, and I learned a lot from them. So take that for what it is. The other thing that I really wanted to mention is that I don't go out of my way trying to use drugs in our osteoarthritis patients. I do think that they tend to be what are reached for a lot of times for veterinarians because they're easy. There doesn't have to be a lot of client compliance. And so you guys as clients don't necessarily have to go very far out of your way to see the benefit. But personally, I think that you really need to focus on using the 4 pillars combined. So thinking about, are there surgical procedures that could fix this problem, if in younger dogs especially? Thinking about, should we maybe do some joint injections? Possibly. Using NSAIDs, doing lifestyle changes, focusing on good exercises that aren't going to cause more instability, and really thinking about and talking about with your veterinarian, well, what is the cause of my dog's arthritis? Why is there joint instability? Where does it come from? What should I be doing about rebuilding muscle to decrease instability? What should I be doing for lifestyle changes to manage pain? And then talking about what can I do as far as a medication goes to just help along the way. I don't think that any of these drugs are going to be the end all be all for arthritis management in dogs. I don't. I really think that you have to do a holistic approach where you're talking about using all of these different management techniques. And if you want more, go check out this video up here for other techniques that we can use that aren't related to drugs. But drugs can be a very important pillar for the pain management side to keep them active for rebuilding muscle. Also decreasing how rapidly osteoarthritis can form by using some NSAIDs when indicated. So talk to your veterinarian, have a discussion. If they just seem to want to go the easy way, maybe look at getting a different veterinarian. I don't know. I know that it's really easy to just say, here's some drugs, have at it. You will see a response most of the time with these medications, but I don't think that that's the whole answer. Thank you guys so much for watching this video. If you have questions about what drugs I like and why, leave them down in the comments. I do my best to answer comments as quickly as possible. So hopefully that works out well. Again, just quick reminder, Patreon down in the description, and have a fantastic rest of your day, guys. We'll see you in the next video. I don't know exactly what it'll be, but more than likely, it'll be a video about CBD oil in dogs.